Monday, April 5th, 2021 Health Committee meeting to order. We have all members present, so we have a quorum. We have minutes to approve from our regular meeting on March 1st. Is there a motion? Motion by Chung, second by Bloomfield. Are there any additions or corrections? Hearing none, Ms. Morlock?
Member Metzger,
Yes.
Member Chung,
Yes.
Member Johnston,
Yes.
thank you. Member Beer,
Yes.
Member Bloomfield,
Yes.
Member Martin,
Yes.
Chairman Schaefer.
Yes. Do we have any members of the public for appearance?
Chairman Schaefer, we do not.
Okay, thank you. Moving on to departmental matters. First up is Jason Tabb from Juvenile Detention. And I don't see him. Are there any questions? He's got his report here. There's no items for action. Are there any questions regarding his report?
Thank you.
Okay. Moving on, we'll go to Jessica McKnight, Health Department Administrator.
So you have my report in front of you. No items for action, just a few updates since the report came out. Announced today that anyone age 16 and over is now eligible for the COVID-19 vaccine at any of our McLean County Health Department clinics. Our new clinics are posted on Thursdays at 11 a.m. on the McLean County Health Department website. And we have seen our weekly average allocation of first doses of vaccine increase slightly. So from about 2,600 to about 3,800. So seeing a slight increase, but our health department vaccine sites remain Illinois National Guard supported, unlike clinics in Adams County, Champaign, Jackson, Sangamon. Those are state-run sites. Our sites are still run by the health department and supported by National Guard. So those state-run sites do see additional vaccines apart from the health department allocations. And I have made a request to IDPH to become a state-run site, but have not heard back. I know there's been some questions about variants, and IDPH has been sending out COVID-19 positive samples for genomic sequencing, but not all positive tests are sent for sequencing, just random samples. But I can say that the B117 UK variant has been identified in McLean County. Evidence suggests that this variant can spread more easily than other circulating strands, but the same strategies that we use to contain the spread of COVID-19 will work against that new variant. So wearing your face covering, practicing social distancing, avoiding gatherings, don't travel unless necessary, washing your hands often, and get vaccinated when it's your turn. So just a few things to point out about our work towards vaccine equity. We've been increasing access by utilizing the National Guard mobile teams. So you may have seen that working with the jail, also provided vaccine to our FQHC, Federally Qualified Health Center, to vaccinate at our homeless shelters. And we've been running targeted clinics in rural communities so far, Leroy, Colfax, and Hudson, and then working with Lexington and Hayworth as well. And we're also coordinating logistics for vaccination of homebound residents, which is definitely a complex and complicated endeavor. But we're working with agencies that support homebound through home health care services. So using the functional needs registry and social service agencies in our community to identify those who need that service. All right, any questions?
Any questions for Ms. McKnight? Ms. Johnston, Member Johnston.
Thank you, Chairman Schaefer. Thank you, Ms. McKnight. You actually answered most of them already, which I appreciate. And I'm very happy to hear about the progress that you're trying to make with the homebound. That's an issue that has been coming up. So thank you for doing that. The only other question I had was that the numbers that we have on the vaccinations, like on who's vaccinated, is that including the people that are getting vaccinated in like Sangamon and Peoria? That's all coordinated through IDPH.
Yes, so through the iCare statewide registry, on their site, when it says fully vaccinated by county, it is no matter where they were vaccinated, it just goes by their county of residence.
Sure. Thank you. And when at some point, if we start to see the numbers creeping up, like it would be really helpful to know, is it people that are getting a little lax with it, or is it the variants that are coming in? So any way that we could find that out would be really helpful. I know that you're not in charge of who determines like which ones get sequenced, but you know, I'm assuming that if we continue to see numbers increasing across the state, that they'll do more of that sequencing. So anything that you can do to advocate on our behalf, I would be greatly appreciative. Thank you.
Anyone else? Member Beer.
Not so much a question, but more so I just wanted to say thank you to your staff. I was able to get my vaccine last Thursday, and it was a really, really simple, very quick and easy. And I thank you guys for all of your hard work that you guys have been doing on. It's awesome. So thank you and keep it up.
Thank you.
Anyone else? Member Chung.
Thank you, Chair Schaefer. Ms. McKnight, thank you again. Like as Member Johnston said, I had a list of questions and you answered most of them just right now when you were giving your report. I did want to ask about a little bit about, I don't know if I'm going to, maybe I'll ask Ms. Scott this too, and the sheriff tomorrow. So you had, was it just one clinic at the jail already so far? And I know that from what I've read is that the number of inmates who decided to get the vaccine was not as high as I guess we would have hoped. I guess I'm just wondering, like, when you're planning to do another one, or is anybody doing anything to try and address that vaccine hesitancy? Like how the Miss Edens was saying that she was possibly going to like show the town, whatever it was, seminar, town hall, whatever discussion that you had. Would there be any plans of possibly showing that to people in the jail? I guess, these sorts of things that we're trying, we all want to get back to some sort of sense of normal as quickly as possible. So again, the one way we can definitely do that is get as many people vaccinated. So I was just wondering if there's any ideas of how to get that number up more. Thank you.
Yeah, and we can definitely circle back around to the jail again. Obviously, we've been prioritizing the Johnson & Johnson vaccine there. So we've gotten limited amounts so far, but we can definitely circle back around and work with Ms. Scott to get another clinic scheduled.
Oh, and also a follow-up. So you say that, was it last month? I guess was it last month that we had not been getting really Johnson & Johnson yet? So now this month is when we've started to get them. And so now it's trying to figure out who maybe the one shot would benefit the greatest. Is that kind of what you're trying to decide right now?
Yeah, so far it's been 2,300 doses of Johnson & Johnson, which is still limited, but ideally our mobile clinics, then, it's one and done, then they're fully vaccinated, and we can actually do more clinics out there in the mobile sites. And again, the jails, and if we need to work with our FQHC for the shelters again, those are really ideal, where one and done, it may be difficult for them to get that second dose.
Thank you very much for that. And thank you again for everything that you're doing. I feel like from what I can hear from people that the site at the Grossinger Arena has been going really smoothly, and I've been breathing better lately. I don't know about anybody else here, but I feel like with the weather getting warmer, it's getting sunnier, and people are getting vaccinated, and I'm not hearing as many sort of stress about people being able to get appointments and stuff. That I don't know, I can breathe better. I feel like I'm sleeping better too. So thank you.
Anyone else? Member Metz.
Ms. McKnight, on page 11 are the complaints for food establishments. And my question would be, are these complaints associated with COVID, or are they restricted to complaints regarding food violations or concerns from the food perspective versus not social distancing, those types of things.
Yeah, I will have to follow up with that. I know in previous reports they were separated, but it doesn't look like they are in this one. I know our COVID complaint had gone down, and just recently, with individuals becoming a little bit more lax, we were starting to see an increase again. But I will check and see what the delineation is with these complaints.
Thank you.
Anyone else? If not, thank you very much. Next up is Ms. Edens from the nursing home, and I understand that she has a family emergency and is not going to be able to join us today. So her report is there, and Ms. Rodriguez will be able to try to answer any questions anyone might have. So if anyone has any questions. No questions. Okay. Sounds good. And then moving on is Suzanne Scott from Adult Detention Medical, and she is working the floor today. So are there any questions about her report? Okay.
Okay, thank you.
Great. And finally, Ms. Rodriguez, County Administrator, has an item for action, request approval and emergency appropriation ordinance, amending the McLean County fiscal year 2020 combined annual appropriation and budget ordinance for the nursing home. Is there a motion? Motion by Chung, second by Bloomfield. Ms. Rodriguez, is there anything you would like to say about this?
No, I think this is, once again, staff put this together for you. It's an annual task that we always have to do at this time of year. If you have questions, we're happy to elaborate.
Member Johnston.
Thank you. Just noticing, I know that we are still having issues with hiring the nurses, some of the staff members, and we're still heavily leaning on these temporary employment services. At what point will we consider, I mean, I know that we recently just looked at salaries, but salaries have also changed in the last year because of COVID. At what point would we consider looking at salaries again?
Chairman Schaefer, may I answer? We are actually right now looking at salaries with Ms. Edens again. She has done more of just a call around to similarly situated skilled nursing facilities to ascertain what their rates are. We're looking at a number of angles. I think even from the CNA standpoint, we're really understaffed, and that can be a challenge to hire CNAs on the county's payroll because of the rates that we pay and also their contributions to IMRF. There's a lot of different angles that we need to analyze to find out what the right model is for us to become more fully staffed on the county side and not lean so much on the agency. However, at this point, we will lean on agency to remain compliant, obviously, and I'm sure the committee understands that. But Ms. Edens really is working hard to try to understand what could be our best formula here, and we could be either as part of the budget process or perhaps even before coming to the committee with some recommendations.
Okay, thank you. Yeah, I'm glad we're looking at it because I look at those numbers and it's like a couple people's salary that we're putting out on these hourly. So thank you for doing that.
You bet. Thank you.
Any other questions? If not, Ms. Morlock?
Member Metzger,
Yes.
Member Chung,
Yes.
Member Johnston,
Yes.
Member Beer,
Yes.
Member Bloomfield. Member Martin,
Yes.
Chairman Schaefer.
Yes. Ms. Rodriguez, do you have anything else?
I do not. Thank you so much. Do not have anything else to report.
Okay, thank you. Our next meeting is Monday, May 3rd. Is there any other business or communication for the committee? No? Okay, hopefully we're all getting vaccinated, since you younger ones are now eligible. And so we have bills and transfers to pay. There's transfers, there's 3 transfers in your packet. I'll entertain a motion for the 3 transfers. Member Johnston, second by Chung. Ms. Morlock,
Member Metzger,
Yes.
Member Chung,
Yes.
Member Johnston,
Yes.
Member Beer,
Yes.
Member Bloomfield,
Yes.
Member Martin,
Yes.
Chairman Schaefer.
yes. And that passes. So we have the regular bills to pay and the auditor has reviewed them and they comply with all the ordinances, resolutions, or policies of the county. First up is Developmental Disabilities Board with a prepaid total of $114,776.17. Motion by Martin, second by Chung. Ms. Morlock?
Member Metzger,
Yes.
Member Chung,
Yes.
Member Johnston. Member
Yes.
Beer, I see you're saying yes. Yeah. Member Beer,
Yes.
Member Bloomfield,
Yes.
Member Martin,
Yes.
Chairman Schaefer.
Yes. Jail and JDC Medical have a prepaid total of $61,794.27. Motion by Johnston, second by Bloomfield. Ms. Morlock?
Member Metzger,
Yes.
Chung,
Yes.
Member Johnston,
Yes.
Member Beer,
Yes.
Member Bloomfield,
Yes.
Member Martin,
Yes.
Chairman Schaefer.
Yes. Nursing home has a prepaid total of $744,940.14. Motion by Chung, second by Johnston. Ms. Morlock?
Member Metzger,
Yes.
Member Chung,
Yes.
Member Johnston,
Yes.
Member Beer,
Yes.
Member Bloomfield,
Yes.
Member Martin,
Yes.
Chairman Schaefer.
Yes. And the Board of Health has a prepaid total of $607,875.43. Motion by Johnston, second by Chung. Ms. Morlock?
Member Metzger,
Yes.
Member Chung,
Yes.
Member Johnston,
Yes.
Member Beer,
Yes.
Member Bloomfield,
Yes.
Member Martin,
Yes.
Chairman Schaefer.
Yes. And seeing we've gone through our agenda, this meeting will be adjourned. Thank you all.